one of the hardest things with the heart is its low regenerative capacity. So the heart has a turnover of heart cells at a very low rate of 1%, and by the time we reach 80 years of age, that significantly decreases by almost half. So trying to find ways of preserving the heart cells that aren't yet damaged is very important, because once they do become damaged, it's very hard for that to become a reversible process. So a lot of pharmacological intervention that we have currently, while they're fantastic for allowing us to live longer with heart failure, with a heart attack, it ultimately will end up, patients will end up with heart failure in the long run, because these drugs can't reverse the effect. So if we can identify ways of trying to reverse those detrimental or remove those detrimental heart cells, those cardiomyocytes, we're hopefully able to keep the heart functioning as we want it to. The way they contract is very important, because the function of the heart is to pump blood around the body. So in vitro, we mimic that model by looking at a series of these systole diastolic contractions and measuring their velocity, their rate, and the way they contract and the patterning. And that's quite new, and in integrating that into AI, we're able to look at very intricate changes in the way systole and diastole takes place. And as these heart cylinder age, we can predict which of these will age healthily versus which of these will age detrimentally by looking at the physiological changes that these heart cells undergo with time.
There we go. So those are the valves.
Perfect. So you can see the ascending aorta.
This is the one that we can see
There we go. Yeah.
Yeah, there's a fatty disposal, so that actually reduces the flow of blood to the heart. Yeah.
It is very touching for me, because as a lecturer who teaches CPR, my father couldn't get an AED, so that's an automated external defibrillator back in my country. And this is why I've taken a lot of time to invest back home to teach CPR. And I also do the UK resuscitation Restart a Heart Day as well, because I want to raise their awareness.
Yeah, saturation levels will be different.
Okay, so that's when you're actually doing your vital signs, and you're going to document that in your news to charts. How would you know if a patient has gone into a cardiac arrest?
The way we measure damage is by looking at what the heart actually releases. So effectively, if a patient goes to a hospital to complain of a chest pain, the things that a clinician would do is basically do an ECG followed by a blood test. So in the in vitro setting and on the bench, we try to mimic that.
Okay. So we're going to go through what a heart attack is, and then we're going to talk about a cardiac arrest.
Senescence is where these cells, they still remain viable and they're alive, but they tend not to function as before, so they have a very different phenotype to what they initially started with. And as a result of that, although they're still alive, they're able to release factors, and these factors can affect neighbouring cells which might not be senescent to become senescent. our next hope is to take that now more to the bedside and looking at the clinical side of this. So using ultrasounds or MRI imaging to integrate the AI into those sort of images and almost mimic what we've done here, but then using clinical images. And so it certainly has a lot of hope and promise to be used in the future.